Welcome everyone. Really nice to be here. My name is Camilla Hutchings. I am the designated clinical officer for SEND for the work in NHS Somerset.
Yes,
Yeah, I can.
perfect, Camilla.
Lovely. I can't see anyone, so just shout if I.
Do you want me
if
to
anyone-
introduce myself, Camilla?
Yes, that's a good idea, Claire. If you would now, yeah.
Yeah, super. So good morning, everyone. I'm Claire Merchant-Jones. I'm the head of SEND at Somerset Council. I'm responsible for a number of advisory teams who support children and young people and educational settings around SEND, and I'm responsible for the statutory SEN team who look after children with educational health and care plans.
Thank you. And together we chair the subgroup of the Accelerated Progress Plan, which is why we're here to talk to you today. So just to start with, before we go into a bit more detail about the plan, this is the collaboration framework that's agreed in Somerset, and this is really important that throughout all the work we're doing with this plan, that we collaborate with parents, we hear from young people, and we do all of these things really. So today from this, we hopefully will give you some information and do a bit of informing. We may not do much doing together because that's something that's happening more in the detail of the plan, but certainly discussing with, listening to and getting some feedback. And as we're going along, we're constantly evaluating that to see what difference we're making. I just wanted to start with that. So as a brief background to the APP, or Accelerated Progress Plan, it's a bit of a mouthful really. But in March 2020, it was, I think, a week before the COVID lockdown. Great timing. We had a very long-awaited inspection by SEND of Somerset, of the whole system in Somerset, by Ofsted and CQC, they came to us and spent some time with us. And the week after we went into lockdown, but we got the inspection done. It took a little while, but we got the report in the summer, and that told us that there were 9 areas that they felt that we were not doing very well in Somerset around SEND, and that they wanted us to target. So in December of that year, it took a while because of COVID and everything, but we eventually got a written statement of action agreed, so that it set out exactly what we were going to do to target those 9 areas. And that was worked on for sort of 18 months plus, take us to the sort of summer of last year, and we knew then we would get a revisit. So in November, December last year, we had a revisit, and that was for, again, a different group of inspectors, but still from Ofsted and CQC, so looking at both the education and the health and care aspect of our systems, to see whether we'd made enough progress against this. A really targeted revisit, saying these are the things we set you to improve. Have you made sufficient progress? And we had a report back in February that said that 7 areas had made enough improvement, but 2 had not. And the areas are listed there on the slide that were felt that we had made some progress in. Not everything sorted, still lots to do on all of those things, but they felt that we had moved them forward in a helpful way. So these were the 2 areas that were judged as not having made sufficient improvement, and as a result of having those 2 areas left, we were asked to develop an accelerated progress plan. So these are 2 areas that we have been working on since that original inspection, and we have made some improvements in those. We haven't not been doing anything, but basically when they listened to parents, to young people, and looked at what we were doing, Ofsted and CQC said, no, you've not made enough progress. You need to accelerate that progress. You really need to tackle these 2 areas to make a real difference for children and families in Somerset. So these are some of the things that have happened since. We had the inspectors don't come back at the moment, but what we do have is support from our region partners who help us with this and monitor us and hold us to account on some of this. We had to write a plan quite quickly on those 2 areas. We had to get together across Somerset and think about what we were going to do in the next year this is only a year's plan. What could we actually achieve in a year? And that plan was signed off by the DfE and NHS England in May. So since then, we've been very busy. We have monitoring meetings. So we had one in July where we talked about how we were going about what we were doing. We've got another one in December with our regional colleagues to tell them some of the impact that what we're doing is having. And we set up the actions that you'll see on the plan has a lead person for it, and we set up a kind of subgroup of those that we meet monthly, and we look so the people who are leading the actions come back and we talk about things, we work out where things need to work together better, and we monitor, are we making a difference? And we have a separate group that's looking at the data, which we'll talk about a little bit later, because we have some key performance indicators and quality indicators, things that we need to monitor that will be monitored on to say, are we making the difference we need to make? This is just for those who are interested around governance, and it just shows that basically what it shows is we are a subgroup of the SEND Partnership Board, and that brings together people from across the system, from health, from education, from social care, from school leaders, we have Parent Carer Forum on there as well. So we have people from across the system. We have SENDIAS. We're going to have Health Watch on there. So we have some of our sort of partnerships with an oversight. And that we report monthly to that board, and we ask them for help with things, or we tell them what we've been doing. They challenge us. And then there's a wider board above that for children and families, not just SEND. So if we've got any really sticky issues, we can report those up to them as well. But that's really just about what, if we can't solve things with what we're doing, how do we get that sort of help, support? So I'm going to hand over to Claire, who's going to talk about weakness 1.
Brilliant. Thank you, Camilla. That's a really helpful introduction to where we are. So one of the areas of weakness that we have to continue to focus on is around the poor assessment and meeting needs of children and young people. And I suppose to put that in terms that we all might understand a bit more and how it impacts on our children, it's really about how we identify the needs of our children as early as possible, how we put interventions in place, we undertake assessments, we have a good look at what's going on for individual children, and we do what's necessary in order for them and their families to get the support they need at the right time, which prevents the sort of escalation into the areas around education, health and care assessments without enough information and evidence about children, and our exclusion piece that Camilla will talk a little bit about in a minute. So there's sort of a set of actions that we're undertaking, which we believe will lead to improvements. One is around our Somerset Graduated Response Tool. So that, I think there's a local live session about it this week. That really describes to our educational settings what they should be undertaking with families and children and young people as they start to recognise that a child might need a bit more additional support around some of their learning needs. It's based on the 4 areas of need, and it's very much thinking and focused on what can happen at the earlier stages. And as you work through, gain more evidence, go through what you'll hear people talk about assess, plan, do, review models. So we've really got a sense of what have we tried, what's worked, what hasn't worked, what can we try next. So that's a really important piece. We've launched a new tool around this at the start of this term, and we think that in collaboration with Parent Carer Forum and schools, we think that this will really help us to really set the standard and expectations around what families and children and young people can expect. There's a piece of work underway around making sure that when children have an education, health and care plan, children and young people have an education, health and care plan, that the provision that's described in that plan is being delivered. That's something that we heard from families, and we hear from families fairly consistently, that they feel as though not only have they had to fight hard often to get an education, health and care plan, but when they've got one, it actually doesn't make the difference that families were imagining. And part of that is because sometimes our education settings aren't putting the provision in place that is described in the plan that people have assessed would make a difference to that child or young person. So we are undertaking a piece of work, our service manager for statutory SEND is undertaking a piece of work to make sure that we have a bit more of a role in making sure that that provision is being delivered. We've got a 12-month improvement programme to look at the gaps in mental health services, and I know there's plenty of work underway in that space. We're going to reduce waiting times for assessment and autism and improve support for children and families through the assessment process. We use training and quality assurance process to improve the identification of need and provision relating to SEND within social care practice. And we'll work with the Department for Education Regions team to make sure that our sufficiency in school places for children with social, emotional and mental health are developed in a timely way. If you could take me to the next slide, please, Camilla. Okay, so far what we've achieved is we have introduced the Somerset Inclusion Tool, which is an additional piece to the graduated response tool, which helps settings to rate and understand and explore their own sense of how well they're supporting children with SEND across 5 different areas aligned with the different areas of need. So a practical way to describe that is a school looks through a tool and says, oh, do you know what? I think I'm pretty good around cognition and learning, but I think I could do with a bit of help around social, emotional and mental health support. And so that culminates, if you like, in a set of scores that the local authority can look at and offer support and target support where it's most needed. So that about 200 of our 260 schools have taken that up. So it's really positive. We'll keep pushing on to get that to the next stage. So the inclusion team have really changed their offer this year. So for children and young people in schools, they will be able to, and schools will be able to access more support in a timely way from specialist staff, which we think will really support schools to undertake support at SEN support level with the right guidance and oversight in place from some of our staff within Access to Inclusion. We've also developed, as I said earlier, the graduated response tool, and we've also developed an early years graduated response tool for our early years setting. There are about 700 early years setting across Somerset. It's a huge number, some very small childminders, some very big preschool settings, and we have to make sure that those settings understand what the expectations are around SEND and again offer support where it's needed. We've had a big piece of work undertaken by our Children and Young People's Therapy Service to make sure that if children have been known to their service in the past and they're undertaking an EHC assessment, that additional information is provided to support that assessment. And there are plans in place, and I think that one of the areas that this is difficult around the autism pathway, and there are absolutely plans in place to support better support for families whose children who have or may have neurodevelopmental conditions such as autism and ADHD. I think we're fairly aware that the requests for diagnosis in this space are quite high, and the more support we can put in place for families, children, young people and settings so that they can be benefiting from the insight and expertise earlier feels like the right thing to do. And that is a plan that's underway at the moment. Thank you, Camilla. I'll hand over to you now, I think.
Sorry, trying to move the slide on and unmute myself at the same time, and it doesn't work, but hopefully you can now hear me and see the next slide. So I'm going to talk a little bit about the second weakness, which I think resonates with a lot of us really, that there are too many children and young people in Somerset not accessing education at the moment. I think it is an issue. I think exclusions and children out of school is rising on a national basis. It's certainly something I'm hearing in discussion on current affairs programmes and things. But in Somerset, we have too many children with who have special educational needs and disabilities who are not accessing education either because the schools are not feeling able, or parents aren't confident that schools are able to include them properly, or because some of those children are being excluded from schools. So this is something that it's one of those really wicked things that are tricky to solve. But when we wrote the plan, these are the things on this slide that we said we would be trying to make a difference, and that we will be monitoring to ensure they do make a difference, and if there's other things that we need to do. So the local authority are trying to support schools in the way that they are with some of the things Claire's just talked about for Weakness 1. And one of the things that they are supporting with is an inclusive practice programme. So that's helping schools to understand what makes the school environment difficult for some children and young people, and how they can, through that relational practice, building relationships and building confidence with young people and with parents. Meeting children and young people's sensory needs is a real issue at the moment. Again, this is not just in Somerset, but where young people were maybe more isolated during lockdown, now expected to go back into busy education environments, and some children and people are really struggling with that. And making sure the environment can maybe be a little bit more flexible in schools to take into account the differing needs of children and young people. So that's one quite major work stream that's going on. We also agreed to think about, and now this is to actually look at those particular 60 children most at risk of exclusion or care, or going into care, to coordinate some targeted and quite intensive support that's from all agencies. This is not just about education, this is from social care and health as well. And this is to help those children and maybe stay in their local school and not be excluded, but also to learn lessons on how do we then support other children who are struggling, and what's the most effective way of supporting those young people and the schools in order to keep them in their local settings wherever possible. And as another area of that, another sort of way of tackling pretty much the same issue, there are area inclusion partnerships which are being put together. So these again are multi-agency, where people are looking much more at a local area rather than the whole of Somerset. It's a huge area. So building relationships in local areas to say, right, these are our young people that are struggling, these are our schools that are struggling to do that. Let's identify those children and young people who are vulnerable and try and put some support in, so we don't get to the stage where they're no longer engaging in education. And then the other one was to work with a group of schools that maybe, because we know there are differences in different schools. Some schools are doing some brilliant work in including children and young people. Others maybe are struggling with that a little bit more. So identifying the schools that maybe are struggling and giving some targeted work to identify what is it about that area or about that school that is making it difficult, and how do we support those schools in a really positive way, coming together around some of those tricky situations. And so what we've achieved so far is that the group of children most at risk has been identified, and some extra support is being put in place, and the lessons learned from that, what works, what doesn't work. I'm working very closely with those schools and families to see how that can work better. So that is well underway, and we're starting to get some feedback from that. We've identified the group of schools who would benefit from further support, and so the work is now starting with those. Obviously things have been a bit quieter over the summer period, but I think things are now increasing in pace as we go into the autumn term. We've talked about the area inclusion partnerships. I talked about those are now informed and happening, and I think there's sort of weekly meetings happening to discuss those vulnerable young people. Still very new, but beginning to have some really good putting together some good examples of work that's being done that way, that is getting children some sort of earlier support. And I think both Claire and I have mentioned, it's the sort of social, emotional, mental health issues that schools say they are most struggling with at the moment, and that we're seeing more requests for help around that area. So schools are being really closely involved in developing a really clear support pathway. There is support out there, but it's not been pulled together into a really clear pathway. The schools are absolutely in the centre of that work. We've got secondary schools already identified, now looking at primary schools for the next phase, and then develop something that schools will find helpful, and that we can then implement throughout the county. So I'm going to go back to Claire now.
Thanks, Camilla. So one of the things that has been really important about this piece of work, and we have found fairly challenging because it's a very short programme of work, setting challenging and realistic targets and key KPIs has probably taken a bit longer than we would have wanted. But what we have got are some really robust KPIs, which areas know that they are working towards either reducing or increasing them, depending on what they are. So, for an example, the number of children accessing education at state-maintained specialist settings for children with SEMH needs, our baseline was back in, I think, February 2023. I'm just trying to make sure I've got my years right. 2023 was that we had 73 spaces, and actually we're already above that target. But as we nudge towards in a year's time, we need to keep monitoring whether we'll be at 160. We also have, so they're the kind of things you can measure, the things you can count. We also have the quality indicators, and that's how we're picking up intelligence and understanding from experiences such as listening events with parent carers. Yesterday I attended a SEND support group that had been set up by the Parent Carer Forum. Camilla's done the same. We want to be really present and involved in the views of families and the views of those people advocating for families, so we can understand if the things we're doing are making a difference. And many of these things will take a bit of a lag to make a difference, but we still want to make sure that everything we're doing, we're understanding what it feels like on the ground, both for practitioners and for families. The engagement and participation piece is also about co-production. So it's about understanding if what we're doing is working and having an impact, but also designing the things that we think will have an impact completely alongside families and young people. And we're really lucky in Somerset to have a really strong Parent Carer Forum and a really strong engagement team with children and young people. So I always feel very privileged to have opportunities to connect with families, and I think we've got a good infrastructure to do that. So that's how we focus on impact. I think if Camilla and I were being really honest, there's more to do in this space because of the length of time the plan is in place for, but we're doing what we can to make sure that what the directions we're going in feels good for people. So the next steps are we're going to continue to work on the actions in the plan. We continue to look at the data and information to tell us, to make sure we understand what it's telling us and if we can see improvements, even if it's green shoots, because they're early stages. I suppose one of the important things is recognizing if we've agreed to do something and actually it's not having the impact we anticipated. Sometimes we have to be brave about that too, and that can be quite difficult as well. We want to keep engaging with parent carers, young people in schools, and finding opportunities as we can keep working together through this plan, and really, really dedicate ourselves to focus on impacts and identifying what we want to see and how we measure it, so we know what was going to make a difference. And I suppose for me, what's important is this is a piece of work, but it won't stop once the accelerated progress plan reduces. We'll still want to merge that into an ongoing dialogue with everybody, with I don't know, people, about how we can continue to improve the experience for children, young people and families who have SEND, and help our educational settings to improve some of the areas that involve them, and how we help that happen. So whilst the APP is for a fixed period of time, this dialogue doesn't end. And you'll probably see more of Camilla and I than you ever want to. Luckily, we're good friends because we see a lot of each other now, and we want to keep engaging with you. So we're very grateful to be asked to do this today.